Thank you everyone for joining us for our third Sanfilippo Speak webinar. This is a family support webinar series that we are hosting to provide families, caregivers, therapists, educators, clinicians, and more any helpful insights into or discussions about pivotal topics specific to navigating life with Sanfilippo. The intent for today is for you to kind of get the best information to meet your family's needs. We have some really awesome speakers today. We have with us Jennifer Mauldin, who has been a board certified behavior analyst or a BCBA. And there will be lots of acronyms, but don't worry, Jennifer has a slide for that today. She's been a BCBA for the past 3 years. Her specialty is medically complex cases, collaboration of care, and caregiver involvement. Jennifer is pursuing her child advocacy certification, and she currently provides in-home ABA services in rural North Carolina for the Center for Autism Nurturing. Carly may be joining us a little bit later. She's had some emergencies at the clinic today, so that is taking up a little bit of her time, which we totally understand. We also, of course, have Ashley Haywood here with us today. She's currently on a break from her clinical research career, but is busy as a stay-at-home mom to her daughter Sadie, who has Sanfilippo Type A. Ashley is also a fierce advocate for all children with disabilities and brings a priceless parent perspective to us today. Thank you all for being here. I will turn this over to Jennifer to get started.
Hello, everyone. Welcome and thank you. Thank you for having me. Thank you for letting me join you all today. Like Cassidy said, I am a BCBA, a board certified behavior analyst. I work in the field of ABA. A little bit more about me. I've been in the field either in ABA or ABA adjacent for about 15 years total. I have been a BCBA for only the last 3. I feel like I am still a baby. I'm still getting my footing and still figuring out life. But I am the assistant clinical director at Center for Autism Nurturing now. Love serving in that role. And I serve Sadie's family here in Albemarle. Very small town, service desert, but a super fun population to work with. Your folks, children there with Sanfilippo, y'all are an amazing bunch. So just to kind of jump in, we'll talk a little bit about what ABA is, who the people are that do it, what it is that we do, why do we do what we do, and then some of the things that, from our perspective, we think it's really important for caregivers to be aware of, both in a Sanfilippo situation, a medical complexity situation, as well as just general run-of-the-mill ABA, if you will. There are some things that a lot of parents are not aware of that we want to share in today's conversation to hopefully empower you all to get the services that your kids deserve. So just to get started, what is ABA? It's a scientific approach to understanding and improving behavior. ABA is a science, indeed. It focuses on applying principles of learning to bring about positive change. Positive change can mean a lot of things. Some of our current best practices include individualized treatments. We tailor each treatment plan and scientific principle to your child in an individual way. We make data-driven decisions, enabling continuous monitoring and adjustment of your child's treatment plan. We have an ethical focus on respectful and human-first interventions, and not so much focused on our data and what that's trying to tell us. And caregiver involvement. Very, very important to make sure that you, the parent, are an active part of your child's therapy progress, goals, ongoing monitoring, and the generalization of skills across various settings. The next slide, please. So ABA specifically with kiddos with Sanfilippo, it prioritizes the quality of life and dignity over goals and progress, so to speak. Typically in ABA, our goal is to increase skills and close developmental gaps, decrease challenging behavior, replace with functional communication, things like that. In Sanfilippo, the goal is a little different with your kiddos. We're very sensitive to that progressive decline that does happen with the systems within Sanfilippo. We focus on maintaining skills, providing comfort, and also kind of creating that environment of support that the children are going to need as they progress from their parents, their caregivers, and other folks in their community. Kind of teaching that tolerance of like, it may not be super fun for somebody to brush your hair for you or your teeth, but we can do it and we can have fun doing it, and nobody has to get hurt or bit or slapped. Next slide, please, Cassidy. Okay, so who can facilitate ABA therapy? So let's meet your typical treatment team. So you have your BCBA, that's me, board certified behavior analyst. I am the clinician responsible for overseeing direct care services. So that's your daily services, collaborating care with other providers. So your medical providers, speech, occupational therapy, anybody else who's present in your child's life, and participating in client related meetings. So that includes your IEPs and medical coordination meetings. BCBAs typically provide supervision to RBTs. We'll talk about who that is in the next slide. On a weekly basis, as well as frequent caregiver training, collaboration to parents receiving services. This person, myself, is also responsible for maintaining the ongoing treatment plan and requesting medically necessary hours from your insurance payer. So we are the ones that make that determination as to how many hours per week you need for your child. BCBAs are also typically licensed, depending on your state licensure board. So they may also hold that credential, such as LBA, which is myself, or LABA, which is Carly. That's just a New England distinction versus a North Carolina distinction. So some states are not holding licensure yet. That's a fun process, but something to be on the lookout for. When you're looking at your daily care, so you'll have a BT or an RBT. That person is a behavior technician or registered behavior technician. These clinicians are responsible for providing your direct care services every single day. So they're the ones that are typically inside of your home if you're receiving in-home services, or they'll be meeting you at the clinic. They are not able to make changes to your treatment plans, but they are able to assist in contacting your supervisor or directing you to the right people for the right things. They're your daily contact. I love them. They're amazing. Angels. LRBTs or student analysts, so lead RBTs or student analysts, those two humans are essentially just folks who are in between the RBT level and the BCBA level, obtaining that BCBA credential, so a little bit higher level, not quite a BCBA. And then there's a little graphic of these folks. Okay, so what does therapy look like for children with Sanfilippo? Home-based services versus clinic services. The biggest difference between these two settings is clinician and caregiver participation. In a clinic setting, you are only going to experience clinicians. It's RBTs, those day-to-day people, folks like myself, your supervisors, and then clinical directors, folks like Carly, who is not yet with us. But in-home services is your RBT and your parent or your aunt or your babysitter or whoever those folks are in your day-to-day life. So it's way more naturally occurring as opposed to your clinic settings, which are very contrived. So way more natural environment teaching at home, way more contrived opportunities in clinic-based. So that typically leads to more generalization teaching. There's a greater ability to focus on socialization and peer play in clinic services, whereas at home we have more focus on those like daily life skills, support, caregiver toleration, things like that. Regardless of the setting, you're going to get that one-to-one individualized instruction from the RBT, as well as that additional support from your BCBA. ABA always focuses on communication, whatever that may mean for your child, social and other related skills, and the best ABA is always child-led. So what does an ABA therapy session look like? These are some of the typical skills that we target within ABA. Functional communication is always number one because behavior is a form of communication. Motor movements, so making sure that we maintain some of that mobility for your kiddos that may be losing some of their systems, specifically like navigating an environment with obstacles is one of the goals that we focus on a lot. Play and socializing. So what games and things can we adapt to your kiddos who are losing their systems, again, to make sure that they're still able to participate with their friends and their same age peers. Adaptive skills. So again, like that brushing teeth, hair, making meals for ourselves and making sure that our day-to-day is under control. Speech and language behavior. So continuing to shape some of that stuff, both aside from communication and in the vein of like literacy. And then coping and emotional regulation, all very big ones. Next slide, please. This is probably the most important one. That's why I kind of gave it its own slide, and that's quality of life and functional skills. So ABA provides skill building for skills like accepting assistance from caregivers during daily care routines, requesting help when needed based on the physical ability compared to the task requirement. So for example, if we're feeling specifically lethargic today, are we going to be able to stand up and go do our meal and then take our shower and then do our, our evening routine? Or do we need to request help throughout that task? And then identifying that within. Tolerating the use of assistive technology, because a lot of our kiddos like to be very independent, and losing that independence can be really tough. Or providing caregiver support to assistance through medical procedures. Quality of life is different for all stages of life and development. The important factor is to ensure that your child is always receiving the programming that aligns with their current needs and the skills that are within their repertoire. Nothing that's over their heads or way too just not challenging for them or not appropriate. ABA sessions include a high level of repetition for practicing new skills as well as maintaining old skills. Programs will include a variety of goals based on your number of service hours per week. Next, please, madam. Okay, so Carly came in and kind of did a Sanfilippo versus typical ABA kind of side-to-side comparison on some of these very specific skills. So looking at like focus on quality of life. In Sanfilippo, it emphasizes comfort, dignity, enhancing quality of life rather than the intensive skill acquisition that we would normally put a typical child through. Sometimes those kiddos can get up to 40 hours a week, and they may run like 150 learning opportunities an hour. And that's a lot. That's a lot. I'm here to acknowledge that. But an early intervention 3-year-old is a very different client as opposed to, say, a 9-year-old child with Sanfilippo. That human is going to require way more of this kind of stuff, the comfort, the dignity, and the quality of life. Sensitivity to progressive decline. Our interventions are adapted to accommodate the changing abilities rather than to assume that steady or gradual progress in skill development over time. Looking at reduced demands, therapy sessions are way more gentle and less demanding to avoid that frustration, with an emphasis on maintaining existing skills and promoting communication, as opposed to like a typical ABA session is a little bit more intense. We're pushing the kiddos to truly reach their full potential that we know they're capable of. And that typically leads to challenging behavior. So it's a much more intense session. Next slide, please. And communication modalities. This is a really, really big one because, again, functional communication is one of our big things in ABA. As Sanfilippo progresses, vocal speech is typically lost. ABA is one of the only modalities, therapy deliveries, if you will, that can teach a variety of communication methodologies, including eye tracking, choice and PECS board, so the little picture icons, as well as like tablet-oriented AAC devices. As you all probably are aware, there's a lot of new communication methodologies coming out. Folks in ABA typically stay on the front end of those because we are a science-driven field, whereas folks in the speech therapy or occupational therapy world may not have that access to the scientific development of these types of methodologies. But as systems progress, your ABA team will be able to adjust and collaborate with other providers, including the speech therapists who do the assessments and who are able to prescribe those AACs and work collaboratively with your ABA team to make sure that we have the best method of communication in for your kiddo. Next slide, please. Okay, so a big one, maintaining skills versus gaining new skills. ABA is all about learning new skills, reducing challenging behavior, getting you, again, at the same level as your typically developing peer. That is our goal. And our typical population is autism. Autism is one of the only classifications that insurance will pay for at this stage in ABA. So what does that mean for you guys? Traditional ABA focuses on increasing life skills and appropriate behaviors, decreasing developmental gaps. For children with Sanfilippo, ABA therapy should focus on the progression of their disease. Skill development should revolve around future quality of life systems. And increased caregiver support is always going to be required. It's not something that, like, typically in ABA, you're looking to fade your services. You want these kiddos to graduate. But at this stage, we're really looking like, how can we make this a long-term plan to make sure that they are comfortable and maintaining their quality of life and their current skills, not gaining new ones. So just making sure that all of those things are in play as we look, or as we collaborate with you all, the caregivers. Which brings me right to this one, cooperative care. highly important and very valuable as a clinician. Co-treating and cooperative care are integral. Especially with a child with Sanfilippo. There's high variability amongst the presentation. I don't have to tell you all that. There's varying degrees of impacts across the physical systems. You know, one child's communication may be severely impacted, whereas another one may not lose theirs in 4 or 5 years later at the same age and the same development up until that moment. So your treatment team should always attempt to coordinate care at minimum on a quarterly basis. Safety and knowledge are key. So having the appropriate specialists, physical therapists, occupational therapists, behavior specialists, you know, all those people that have their specialties, we all come together and create this beautifully well-rounded picture for your child, as long as we're all working in harmony with one another. Providing access to documentation, notes, and medical information is also really imperative. I really appreciate that about my friend Ashley over here, because she does not hesitate to email me. You know, she'll get an assessment done at a speech therapist or a sleep study, and as soon as she gets the note on Sadie's My Chart, she sends it to me. And that is so valuable, because I can then bring it to my internal, you know, collaboration team, and we can determine what's best for Sadie next. Who else do we need to collaborate this care with? Do we need to now talk to her IEP team, make sure everybody's on board? And, you know, kind of with being in a service desert, leading that charge is really important for me, for Ashley. So cooperative care is cornerstone. And same with working with other providers. I cannot stress enough that medical diagnostics impact service delivery or efficacy of ABA treatment. If you are sick or you don't feel well medically, your behavior is impacted. You know, hangry is a real thing. You're hungry and you're just like, that's real. That's real. Behavior scientifically, that is real. So anyway, pain, you know, discomfort, any of those things may cause our sessions not to go super well. So again, that care coordination is so important to make sure that we are not only implementing the appropriate strategies, but if we need to make a change and we need to do so quickly, then we can find that out, both from you as well as coordinating that care on a regular basis. We can also gather data and provide that data to your providers, because we're there every single day. Unlike them, they don't have that advantage where we can monitor seizure activity, sleep patterns, eating, you know, all of the habits that your providers may want information about. We are able to provide that to them. Next slide, please. Okay, amazing. I was hoping we were getting here. So what should you all ask when you are looking for an ABA service provider? Carly actually has this list that she includes in her parents' Bill of Rights, if you will. And there are a couple of major categories that we want you to focus on. So provider qualifications and experience. What are the qualifications of the clinicians? Are they BCBAs? Are they RBTs? Those people are certified humans. They're not entry-level humans, right, to work with your kiddo. How much experience do they have? How much experience do they have with Sanfilippo specifically? How much experience does that person have with medical complexity? Because that's our buzzword in ABA. In regards to assessments and treatment planning, how do you conduct your initial assessment? Do you need to come to my house? Do you need them to be present and able to attend? Are you going to be able to adjust your assessment to this child because they don't respond as a typical child would in an assessment? Can you provide examples of how treatment plans are individualized for children in your practice? Can you give me an example of how you do not copy and paste from this child's book to that child's book? How frequently are your treatment plans reviewed and updated? It should be minimum once a week. Minimum. The buzzword here is to find out what your percentage of supervision is. Most agencies in the industry have a 10% supervision standard. So if your child receives 40 hours of ABA therapy per week, typically they'd receive 4 hours from me, the supervisor. At Center for Autism Nurturing, we do a 20% supervision model. So if your child gets 40 hours, they get 8 hours of my time, double your typical agency. We don't always get that approved through insurance because insurance is standard 10%. But we also recognize that your children need more of our time. You don't need as much direct care. You need way more supervisory support and clinical director support. Actually, that's what Carly's doing now. She's supporting a family who has a medical complexity that was having a tough morning. But that, having access to someone like Carly, the director of clinical services, or myself, an assistant clinical director, like we have the knowledge that we can also bring other BCBAs in and other folks from the other organizations and all these, sources. It's so important to figure out who you're working with. Your service delivery, what's the structure and frequency of the sessions? Is it daily? Are we doing 3 hours at a time with a break in between? Because that's probably something that your child will need. They might need a break in between those sessions. Will my child receive one-on-one, group therapy, or both? One-to-one's not always a guarantee. It's an absolutely important question to ask. How do you ensure consistency in services across different therapists? One of our biggest downfalls in ABA, and I'm here to acknowledge it right now, is scheduling and staffing. It's tough. It's tough to maintain. It's a daily service model, so it can be tough for us to maintain our consistency. But all good companies have plans. Do we have floater RBTs available that are familiar with your child and their treatment plan that can come and serve in the event of a cancellation? Is your BCBA willing to come and see you when your staff cancels so that you can have your consistency? Valid questions. Family involvement. How will I be involved in my child's therapy? We've already determined you will. 100% you will. But how? What training or resources will you offer me when I come into your program as a parent to this child? How do you communicate progress, and how will you involve the family in decision making? So every single time you add a goal, are you going to ask me? Or are you just going to be out here doing things and you check in with me like once a month? Important. Data and progress monitoring. How do you measure and track progress? Is it daily? Is it weekly? Is it, using a system? Is it a paper data system? Like what you got going on? Can you show me examples of how data is collected and then used to inform treatment? Data-driven decisions, right? Let's make sure. Ethics and approach. What is your approach to managing challenging behavior? Do you go straight for restrictions, holds, and maneuvers, or are we more of that positive assent-based approach? How do you ensure that your interventions are ethical and respectful of my child's dignity? In the old days of ABA, it was an ugly time, and we didn't really respect people's dignity and things like that. If you find a program now that is not child-led or not assent-based, not trauma-informed, you're likely to find yourself in kind of some old ABA ways. Strongly recommend you ask questions about that. And anything you're not comfortable with, at the end of the day, you are the parent and you're in charge. So you say, we're not doing that anymore. And that's the answer, my friends. And I want you all to be empowered if you walk away from this call with nothing else about ABA, but to say, we're not doing that anymore. And that's okay. And if your provider says, oh, I don't think that's a good idea, guess what? Red flag. Red flag. No thanks. Okay. I'm off that. Special considerations. Do you have experience working with children who have co-occurring medical conditions? Because typically we don't. It's a very important question. A lot of ABA companies will not take children who have medical complexities because they don't carry the appropriate insurance, or they don't have their staff aren't trained, or what have you. How do you adapt your interventions for children with progressive conditions? Are you going to expect my child to obtain 45 goals per authorization period, which is the typical rate that our insurance companies want to see? It's not going to happen. Logistics and support. What is your availability and flexibility in scheduling sessions? If we have a doctor's appointment once or twice a week, or we need to go to physical therapy, are you able to work around that? Can our RBT come with us? What support do you provide for navigating insurance coverage? That's not my jam, but we've got people for that, and they're amazing. We don't have to worry about it. How do you handle transitions, such as moving from one therapist to another or transitioning out of services? So are they going to leave you high and dry whenever their therapist quits, or do they have a plan? References and outcomes. Can you provide references from other families who have obtained your services, and what outcomes can we reasonably expect from your program? Next question, please. Excellent. So just to kind of wrap up mine, I'm going to pass over to Ashley. I went over my time just a little bit, but I think the most important thing is to always ask your questions. You're coming to me for a service. I owe you answers. You don't owe me anything. So I want to empower everyone to be your child's biggest advocate. And if someone makes you feel like you're being annoying or you're pushing too hard or anything like that, red flag, run away and run to me. Thank you. I'll stop. Back to Ashley.
Thank you, Jennifer. You're amazing. I love you. Okay, so again, like Cassidy said, I'm Ashley. My daughter is Sadie, and she has type A. And we started ABA, I want to say it was like January or February of this year. So we've been doing it for a little while now, so we're kind of in the groove of it. Um, so a couple of things I want to talk about is, again, all of the questions that Jennifer just went over, like I want to reiterate those. I had given up on finding an ABA provider because everybody was like, you have to start off with 20 hours a week or we won't accept you. And I was like, I can't commit to that. Like, she's in school, we have other therapies, and I don't even know if this is going to be worth it. Like, I want to start at, you know, 10 hours a week just to see how it goes. So I literally had given up, and I was just like, we're just not going to have ABA. It's, not a big deal, whatever. We've got lots of other stuff. And I did have a friend that referred me to the Center for Autism Nurturing, and I'm so glad. Like, it's been a game changer for us. Um, and I want to talk about too, how they will travel with us to different appointments. They want to go to these appointments just so they can see like how Sadie does, how Sadie interacts with things, her behaviors. She has a really hard time with getting her O2 because she won't leave the thing on her finger. She has a really hard time with blood pressure. So those are things that they come to appointments with us. They observe, they notice all these things, and then they work with her on all the different things that she needs working on. They even set up, we see Dr. Munzer at UNC, and they even set up a virtual meeting with him just to kind of get an overview of Sanfilippo from a clinician's standpoint and understand what they need to be working on, as opposed to, just a typical autism patient. And that's really huge to have somebody that's willing to step up and go that far above and beyond. I mean, that's even further. That's going the extra 10 miles. Like, that's been amazing. They've come with us to appointments with Dr. Munzer to just kind of pick his brain also. And that's really big. I don't know that every company is going to do something like that, but they should, if not, because they really need to learn Sanfilippo, because it's not something that they're going to be used to. Let's see. And the controversies in ABA. So, like she was saying, old school ABA, it's like a restraining, it's reward based. And when I talked with them in the very beginning, I was like, I understand how ABA works. I've done my research. Sadie's not going to understand these things. She's not gonna grow and progress the way normal kids would in ABA. Like, you're gonna have to adjust the way you do in order to fulfill her needs. And they were very on board with that. They were, yeah, we'll figure it out, and we'll do it. And let's see. I'm trying to look at my notes too, sorry. Okay, and so the assent based. So with every Sanfilippo child, everything is child led, and ABA is no different. Sadie has ways of, telling them, she needs a break. Like, she'll say sometimes that I need a break. She gets frustrated. She will start like flailing, running away. She'll run to me. So they know when to ask her if it's time for a break. And when she gets a break, they'll give her iPad for a couple, like 5 minutes or so. and let her like calm down, maybe eat a snack, have something to drink, and then they go back into sessions. And some sessions, it's like she's having a break every 10 minutes because she's just over it and overstimulated and just not having it. Um, and that's okay. Like she still gets through what she needs to do. And every day is not going to be perfect, and that's in any kid. And with Sadie's team, so we have an awesome team. She has 2 therapists, and they have their personalities are so complementing. Like one therapist is very shy, introverted, calming, and all of that. And the other one comes in hot. Like she's loud, she comes in singing, dancing. And so with Sadie's long sessions, it's good that she has both of those, because if she had the loud one, it would be just way too much and she would be so tired. But it's the calming effect plus the loud energy that the other one brings in that like really complement each other. I don't even know if they know this, but they complement each other, and it really works well for Sadie. Like she has both. She has the best of both worlds. Um, and Sadie loves her therapist. Like every time they come in the door, like she squeals, she gets excited, she runs up and either slaps them or hugs them, and they know to expect that. It's not they're not like offended if she runs up and like hits them or something. But I mean, they have this great relationship, and it's it's awesome to see that relationship also. Um, and so for changes since Sadie has had ABA. And this has only been, like I said, since January, February-ish. Her talking has increased like tremendously. She has gained words back that she had lost. She's still not talking like she was. She's still not talking in like complete sentences, but singing songs, it's like instead of filling in a word or two, she'll fill in like a verse. Um, and I've noticed, so that's how I kind of, we don't always have like sessions where it's like, okay, Ashley, here's what you need to be working on with Sadie. I just kind of am in the background, like listening and kind of just seeing what they do. And I notice things, and like, instead of, if she drops her chewy on the floor, her therapist make her say, oh, I've dropped my, and make her say the word, and they make her bend down and pick it up. Me, I'm just like, here's your chewy. And so they have taught me that like when things like that happen, to make her, and they didn't even like sit down and tell me this, it's just my observation from watching them. And it's like, instead of just handing her the thing, saying it for her, asking her in a way of her saying it, and then having her also bend down and pick it up. Life is not as easy because it takes longer. We're standing there like, pick your chewy up, let's bend down, pick your chewy up. Like, and every time I don't do it, some days it's no, but it's just those observations that kind of help you learn how to navigate and the best ways to. Some days I feel like I'm a therapist too. Like I'm in there with them and I'm like, okay, Sadie, what did you drop? You dropped your, and then make her pick it up. So it's like, it works. And it has helped her bring back some of her words. And I mean, I'm forever grateful for that. I mean, that's huge. Um, and okay, so the schedule is the very hard part. And that was hard for us in the beginning. And like I said, when I talked with them, I was like, I don't have 20 hours to give you. I've got, she's in school, and Sadie is very social. So school is very, very good for her to have that social aspect. And I want her to go to school. I want her to experience the things that school has to offer too. So we started off, and I don't really remember exactly, but we started off like doing 2 hours a day. And we just kind of build up from there, because if we started more than that, Sadie would have just been way too tired. Like it would have been too much. And so we started very slowly, and we've worked our way up over the summer. She was getting a lot over the summer. Like they were here probably 20 hours, maybe even more. over the summer. And now that school's back in session, I do get her out of school about 2 hours early, and we come home and have sessions. But I think it's worth it because honestly, the therapies that she gets at school, they have 15 minutes here and there. It's not a lot, but I think she gets more out of ABA, but I still do want her in the school setting. And we do all in-home sessions with ABA. They are looking at getting a location that we can go to, but like Jennifer was going over the differences, I still want to have them in home some and then also do in clinic, because I think that would benefit Sadie also because there's a social aspect of being in the clinic. And let's see. Yeah. And then also for schedulings, like I try to tell them anything that we have upcoming, like any appointments, any like things that we're going to, I try to tell them that like the beginning of each month and kind of have it set out and so they can plan. And a lot of times if we are, going on a play date, they love coming to play dates so they can see how Sadie interacts on things like that. And I kind of have a free babysitter and I'm not mad about it. Like it's, and Sadie loves it. Like she's there with her friends and I have somebody to help me, navigate, because it's not easy taking a Sanfilippo kid out in the world. It's difficult. But they always come and it's just like, I mean, we're together so often. It's kind of like their family. So and it is kind of odd. Like you have somebody in your home for like 20 hours a week. It's a little weird, but you have to ask those questions and you have to find that therapist that's compatible with your kid and your schedule. You have to find the company that works best. And we got lucky. We didn't have to go through different therapists. The first therapist that we got were spot on. And I don't know what they do to figure out who gets what kiddo, but at least for Sadie, it worked amazingly. And the role of the parent caregiver while our therapist is here. So they have to have an adult present. So I'm always here, but I'm not always, I'm doing things around the house. I'm not always involved in their sessions, but then sometimes I do get involved so that I can learn like how they're doing things. And the importance of an autism diagnosis. So we had Sadie diagnosed really young, and it was just for ABA therapy and to open the doors to different therapies, different services, to have that diagnosis. And I know at least for North Carolina, I don't know about other states, but you have to have that autism diagnosis for insurance to pay for ABA. And with Sadie's story, it's a little different. We got diagnosed at 3 months old with Sanfilippo. She was in a clinical trial when she was 3. So she was doing very well. Like we don't even know how many words she had because we lost count. She was speaking in super long sentences. And so when we got her autism diagnosis, it was difficult. And the doctor was a little hesitant to give it to us because she only passed it by like a point or two. But I kind of had to reiterate, the nature of this disease is she's going to regress. Yes, she's looking you in the eye right now and talking to you, and she's very social. Later on, we don't know. And I did explain to him, I'm like, I know that this is not a true autism diagnosis. I understand that. What I want is to have this diagnosis for services and just different therapies and things. And he was very willing to do that, but he did make sure that I knew that it's not a very true autism diagnosis, which is fine. But I would recommend, at least getting that diagnosis, if nothing else, for down the road, different services, or if you want to do ABA later on down the road, you have the diagnosis. So I would really highly recommend getting that diagnosis. Next slide, please. Is that the last one?
That was the last one for you guys. Okay. So we have some questions that we can go over. And Ashley, you were on a roll, so I'm actually going to start the first one for you. Kayla Bucknell in the chat asks, would you have started ABA sooner?
Yes. Yeah. And the only reason I didn't is because we couldn't find a company. But yeah, I would recommend getting it in as quickly as possible.
I wholeheartedly agree with that. We know that the benefits of early intervention therapies for all children, not just children with Sanfilippo, are great. And ABA is included in that.
Yep.
In any early intervention, like any
Yes.
services, not just ABA, but any services that you can get in at any time, sooner rather than later. Earliest intervention is always key.
And I will say too that since the school year has just started back and we didn't do ABA, we had just kind of started getting ABA when school was ending last year, or this past semester. We are going to try to set up, I don't know how we're going to do it, monthly, every other month, sessions with all of Sadie's therapists in the school, her teachers, some of her doctors, and all the ABA therapists and Jen, and just to kind of go over like, where Sadie is, what we're doing, so that everybody's kind of on the same page and everybody's kind of working towards the same goals. And Jennifer's the one that's being instrumental in setting that up. And I don't know if that's a typical ABA company's job, but if not, it should be, or it's somebody, there should be somebody that does that. And that takes stuff off of me also. So I'm really grateful for all that you do for helping me.
Well, I mean, and ditto. Like honestly, this truly the best relationship that you can have with in an ABA situation is what Ashley and I have. Like I use our relationship a lot as like a best practice example because she's very open with me and she's willing to tell me when things don't work. That's really important because if it's not working, I can't see it every day. The therapist will give me feedback when I come. But you're the one. You're so important to me. I need to know, right? And I'm happy to support you. And I'm glad you brought that up, Ashley. I skipped over that in my portion. It is a good point that not all ABA companies are going to do these services for you. Not all companies will be able to go and do collaboration of care meetings. And I will be really honest with you why that is. It's because that is not a billable service. I cannot bill for coordinating care with some of your providers through your insurance company, meaning that my company does not get paid for me to ride over and hang out with you guys. But places like Center for Autism Nurturing and other smaller agencies, there's a whole soapbox that I could get on about that, but small agencies in general are able to allow their clinicians greater service times, that 20% ratio, more non-billable opportunities to support folks like you all who need that added support, both like within your doctor's appointments, but like Ashley said, at IEP meetings, scheduling all these meetings with, the folks in Sadie's life to make sure that she's safe, but also getting the best services that she can across the board. I'm happy to do that as a provider, but I've also worked at other companies where I'm not allowed to do that for you, which is part of why I left those companies and I'm here now, because I think that this is part of not only a valuable service, but like it's vital participation for us all to provide the best service we can to your child.
Yeah.
Like you who will push for that and see the child's needs as a person, as a well-rounded individual, and what you can do for them. So I do have a couple more questions. So what is like if you could give an estimated timeline on when a parent may reach out to you and say, my child needs ABA therapy services, and when those services would begin with you guys in the home with the child?
That is very variable, obviously per company. Typically, it's about a 3-month window. So you onboard, you do your insurance, you sign all your initial paperwork. That's pretty quick. By the time you meet your initial assessor, I write a report. It takes a really long time. I reach out to your insurance company. I get your authorization. We build your team. We get your schedule, all those things. So usually it takes between like 8 to 12 weeks. 8's on the early end, 12 being, I mean, it's a time lengthy process. I will not lie to you. Yeah.
Okay. So is there like a minimum amount? I know we kind of touched on this, but I just want to make sure. Is there a minimum amount of hours that daily or weekly that a child has to meet to qualify for ABA?
That's a really loaded question, and I'll tell you why. The Center for Autism Related Disorders, CARD, established some protocols for ABA therapy about 2-3 years ago that essentially anything that is 25 hours or more per week is considered a comprehensive treatment program. Anything 25 hours or less is a focused treatment program. Now, some companies have taken that and done a 15 to 40 and a 15 to 0 model for focused and comprehensive. But to answer your question, because of that guideline, most companies will not let you get away with any less than 15 because that's considered a fade plan. At that point, you're ready to graduate services. You don't need us that much. And again, ABA is traditionally such a heavy daily service model that you will see those 20 to 40 hour numbers way more frequently than you will see 0 to 20s. So to answer your question, most companies are going to require that you meet their clinical recommendation, which makes things even stickier. Because like if I were going to tell Ashley what her clinical recommendation is, it's like 35. I don't ask her to meet that. A lot of companies are going to say meet 90% of what your clinician says you need to hit. So if that's 40, you better be hitting 37.5 hours a week, which is crazy.
Yeah.
Small companies. They just don't have the same requirements as the big ones do. The big ones are very cut and dry. It's like if you don't hit this number, you can't come, period.
With a small company, is there a way to, is there like a national search? I know some states have state by state search where you can look up a provider's qualifications, like PT. I know physical therapy, occupational therapy have those state systems where you can look up their name and see when they were certified. Does ABA offer that?
They do. Let me send you a link to that.
We'll put that in our Q&A. So while you're sending me that link, another thing, so Ashley, you mentioned this, that Sadie sometimes, she needs a break. She wants a snack. She needs to have a meal. We might break for that. Is that something that you guys typically do during sessions? Are food and snacks allowed?
Oh God, yes. Do you need
Oh, they
food
feed her
in your
for
day?
me. They feed her for me, like
That's true. That is true.
They do work on those things though. Like that's part of her goals is working on eating
Like
and
full
she shoves everything in her mouth. So they work on not doing that, making sure that she swallows. And I didn't go into that when we were talking about the benefit or how she has showed progress. Like they have started making her open her mouth to make sure that she has swallowed her food. And so that's very beneficial because she chokes. And she's gotten good at that. And that's one of the things that's their goal. So yeah, we snack, we eat, we sorry, I
Is
didn't
it
mean to
allowed? It's encouraged.
yeah.
It very encouraged because honestly, like I don't go more than like an hour or two without a snack every day. So like I literally would never expect anyone else to.
Good to know. Good to know. So Ashley has touched on some benefits that she's seen in Sadie since starting therapy. Jennifer, what do you think Sadie has benefited from in ABA therapy that you've seen over time?
I would say the feeding is one of my biggest, like if I'm talking about Sadie in public, it's like she is now clearing her own mouth. Like she's doing the mouth clear and like big alligator chops is what we're calling it when she's chewing. Her feeding has gotten much safer. And that's really my goal for Sadie is to make sure that she is safe in her day-to-day life. She's looking at her feet when she walks. And I know that doesn't sound like a big deal, but like before her spatial awareness was really tough and she would trip over things. She's very clumsy, bless her little heart. But now she looks at the ground and she doesn't fall as much. So that's amazing to me. And last but not least, I do agree with Ashley that some of the language that we've seen, just both some of what I feel like we've saved, as well as some of the things that have resurged that were not present when I first met Sadie, have just absolutely been incredible. That was not something that I expected to see when I started working with her. And I certainly didn't, we're not pushing her for that, right? Like that's just a built-in part of what's happening in her sessions. It's absolutely phenomenal.
That's amazing to hear that. And it's great to see your interactions today. And I hope that anyone watching this and participating in this takes away this relationship that we're seeing with Ashley and Jennifer is so crucial to, your child's growth and success and just happiness. And this is just so great to see this. So I want to ask one last time, that was all the questions that we have, kind of sent in. We did have one comment that I do feel is important to highlight here, that meeting the criteria on autism testing allows for a diagnosis regardless of the underlying genetic and other causes. So, our children with Sanfilippo deserve equal access to ABA therapy and autism services, even if you don't have a diagnosis of autism, the same as children who have autism, and we wholeheartedly agree. So thank you for highlighting that in your comment. It's very important. We all agree that equal access to this treatment is crucial. And we're here talking about specifically North Carolina, so that may not be a limiting factor in all states or all countries having a diagnosis of autism. So make sure you're asking those questions. Is that a requirement? If so, how do we go about maybe getting that? It might vary in your state. So we'll ask one more time if for any last minute questions, comments, experiences you want to share. And we'll give, just a couple more minutes if anyone wants to ask any questions. I will have one more. If Jennifer and Ashley, if you guys want to maybe share like a highlighting moment from therapy with Sadie, something that you find just funny or just lighthearted, heartwarming that you can think of. I know we shared the cover image for this session
That's
was
what I was gonna
some
say.
brownie baking, which we
That
thought
was
was
fun.
hilarious, really highlights what Sanfilippo and ABA therapy can look like. So do you guys have any other experiences that you guys want to share?
We all think this is funny. The first day I met Sadie, she would not speak to me. She was just like, she was sitting with Ashley. We were in her playroom at their house. Ashley was telling me all about Sadie, and Sadie's just kind of like, eyeball. I mean, like just the whole time, just not super sure about me. And I'm talking to mom, and she walks over to me and she stares me right in my face and just starts snorting like a pig.
Oh
And
yeah.
I couldn't help myself. I just busted out laughing. And I looked at Ashley like, what is going on right now? That's really funny. And Sadie has snorted at me every time she sees me since November of last year. She still does.
Yeah, she can.
It brings me so much joy. Like, I don't know why. And so Ashley like teases her and says, is there a pig in this house? Where's that pig? Pigs live outside. Stuff like, it's so funny. Like, that brings me so much joy.
Obviously, you guys have a really great relationship, which brings another question that we just had in the chat. What is a way to handle it if you feel like your therapist isn't a great fit?
Oh, I don't know. I don't have firsthand experience on this, but I guess you would just have to talk with your BCBA and be like, this is not working. Nothing against this therapist, but they just don't. You also have to make sure that the therapist and the BC, like everybody understands that maintaining in Sanfilippo is progress. Like that's a good thing. And
Yeah.
most therapists all the time are wanting to gain things. And that's, I have to tell her therapist all the time, our goal is not to gain. Our goal is to maintain. If we gain,
That's amazing.
extra. Yeah, that is extra and amazing. But our goal is maintaining, and you kind of have to make sure that they understand that. But you would just have to talk with the BCBA and just, this is not the therapist for us. And I don't really know the answer to that. I guess that's really the only thing.
If I can, I would say like I haven't been in BCBA now for 3 years. It happens. It happens all the time, honestly. It's a bummer because like we are excited to start you. We're excited to have you a therapist, like blah, 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 whatever. But honesty is key. Remember what I said about things not working? Like even if Ashley's like, this goal isn't working, it would be equally as important for her to look me in my face and go, Jennifer, that lady is not nice and I don't like her and I want her out of my house. If she said those words to me, I'd be like, oh my God, I'm so sorry. Let me get her out of here. No worries. We'll find somebody else. It's not, I know it's a very anxiety riddled point with families, but truthfully, like we also recognize that like personalities are different. Not everybody meshes. I think Ashley, when you first met your team, you probably had doubts about your shy human.
Yeah. It's
right?
like, Sadie's gonna
She's gonna run all over her. And we talked about it a little bit. Ashley was like, I'm not super sure about it, but I'm going to give it a chance. I don't know if you even remember that conversation. It's been so long ago, but I mean, we gave it about 2 weeks. We revisited. And by that point, we recognized that the two of them were really complementary and it was going to work. Now, if she would have said, I'm still not super sure about it, I probably would have just pulled that person. More importantly, the reason I wanted to jump in here is if you don't like your BCBA, that's a hard one, because who else do you contact? If they're the contact, you find out who their supervisor is. That person, the clinical director, should have signed your treatment plan. Their names are all over websites. If you do not know who they are, then you ask your BCBA, hi, I need to speak to someone in your organization. Who may I speak to, please, and thank you. It's part of our ethics code to not argue with you about that and be like, here you are, friend. So sorry if I've offended you about something. That's another one of those points where I want everyone to feel empowered leaving this call of like, advocate for yourself and your child. And again, if they give you pushback, then they're probably not a good fit for you and your family.
Yep. And one point that we didn't really bring up here that I do want to highlight is, you know, we have talked about where Ashley is a little bit of a service desert. And that just means that there's not a lot of options around or nearby. But if you live somewhere where there are more options, look for others, shop around, as we say. You know, find the best fit for you. And if the first one isn't, try another one and find what is the best. You are your child's best advocate.
Yep. And it would be the same with, you know, PT, OT, and speech, like any therapist or any doctor. You know, if you don't mesh with a doctor, you just politely say, you're not listening to me, and
exactly,
I need to advocate for my kid, and this is not the best fit for us.
Absolutely.
I mean, if you have to get ugly, you have to get ugly, but
that's exactly right.
You're advocating, so you have to.
If you have to be a strong advocate,
assertive,
you are an assertive, strong advocate. Go for it. All right. Well, thank you guys